So the one person that has inspired me to not only serve more, but to become a physical therapist was Dr. Patty Towsley, who used to work for the Jackson Clinics for years and now retired. So I worked alongside her with equine therapy for physical therapy in Northern Virginia at a therapeutic riding center. And she noticed, I loved horseback riding and talking about motor control and coordination and movement of a person and the horse. And she just built that up and taught me a little bit more about biomechanics. And that's what got me into the profession and into service as well. I've always had service projects or volunteering, middle school, high school, college. So it's already been there, and I was looking for a company that was very similar to that. And I was very excited to learn about the project in Kenya, and I've been there a couple of times too. So they have the local projects here. So working with the high schoolers is fantastic, and the youth soccer, I've done that as well. But my favorite projects that I've done is working with mentoring students in Nairobi and doing the teaching a little bit this year for the cervical, thoracic, and rib course at the Kenya Medical College. I've done a lot of other projects, some international throughout my life too, but I feel like this one in Nairobi is the most important one, and I feel like it's the one that's worked out so well because it's sustainable. It's something that is going to expand. These students, it's not that I'm just teaching them. They're going to go home to their clinics and they're going to teach their colleagues as well. So it's lifting up an entire generations of physical therapy within not only their country, but to the countries around them. And the whole idea too is that it's self-sustainable so that they become the teachers. So I feel of all the international projects I've done, this has been my favorite one. It was basically being surrounded by residents who would challenge you and just nerd out with you whenever you felt like it. So it was a lot of intense just talking about physical therapy and learning how to think critically a little bit more than you did, thinking in a different way, being challenged by your colleagues and by your mentors, and just building your skill set as well. Going into physical therapy school, I wanted to do a residency program. Definitely a proudest moment would be finishing that program and then passing the OCS. Erin McDonald is the colleague that most impacted me. So, I was with her when I was a student, and she, not only encouraged my learning, but also she was bringing in concepts that were a little bit higher than what was expected of me as a student, just because she was matching what I was giving her. So she was finding my interests and encouraging them and finding patients for me that I could work with as well. So just getting into the field, she was my main mentor. And it's then when I started at Manassas, I worked alongside her. So she impacted me because any questions that I had, not just about patients, but just organizing that and trying to get my life to be like, hey, I'm working now. She was the main person. The ones that I remember are the ones that usually come in at their lowest part of their life. And I don't mean physically, I mean mentally and emotionally. So one person I can think of is someone who I really related with was a young woman in a motor vehicle accident who fractured her pelvis. And it wasn't just the physical aspect that she couldn't walk, she couldn't keep up with her friends and family. It was also what happened during the accident and the litigation afterwards. She was just not in a good space. And of course she was working with a therapist at the time. But she'd come in and say, this is the best part of my whole week, is just so I can interact with you guys, I can exercise, and my body feels a little bit better. And that's very similar to when I was in high school. I had an ACL reconstruction and I had a meniscus repair, and I couldn't get all my frustrations out through soccer at that point, and I had family crisis going on at the same time. So I can relate to, going to PT and feeling, oh, I feel like I'm kind of back to my normal schedule, just exercising a little bit. And then when you end physical therapy and you get back to what you want to do, it's such a relief, and stress is just gone out of your life. Well, I never thought I'd be clinic director, so that's definitely a big change. You're used to managing patients, now it's managing other physical therapists. But everything that I love about the TJC and developing my own skills and being the best. I'm trying to learn how to help other people do that. So it's definitely also one of the biggest challenges too, but it's been rewarding as well. So that's probably how I've changed the most, is just that goal I never really had. So in realizing that and being like, oh, okay, this is actually really fun and something I'm interested in doing. I've always known I wanted to eventually have a facility dog, and even when I first started, I think a couple of years after, I wanted to get through residency and then make sure I had that all set before I added in a dog to my practice. Dogs themselves give you unconditional love. So a lot of physical therapy, when patients come, pain pretty much equals depression. It equals a negative emotion. So a lot that we do is trying to bring them into a positive light in order to improve prognosis, whether it's, oh, let's do some exercise that's fun. Well, a dog's going to do that. You're going to walk in, even if you're not working with him, everyone has a gigantic smile on their face when they see him. Say you were nervous squatting. If I get you to start fetching with him, you're going to squat and not even know it. Like, it's going to be fun. And it just really encourages people to come in and, be happy. I'm excited that we're getting to this caliber of PT, and that when I first started and I wasn't even in school, there really wasn't that much continuing ed after you finished your doctorate program, and that there was such a disparity between each clinic and clinicians within those clinics of who was better than the other. I feel like especially we're leading the way of, if you come here, like, we're building up the profession. We're heading to that direction, and everyone becoming a little bit more specialized in what they're doing, so they're not just generalists. So that way we're getting a patient not just, the 80% better, we're getting them to their 100%.